So my name's Dr. Mark Nathan. I am a medical oncologist specialising in treating breast cancer. When you're checking your breasts, it's useful to try and do what we call feel on the first, so the first of each month. Just have a check of the breasts, feeling for any lumps, if there's any pains there. Often the best way to do it is to work around the whole of the breast, so maybe start at sort of 12 o'clock on a clock face and then feel all the way around that, see if there's anything there that's new that wasn't there before. It's also important to feel sort of under your armpit as well for anything that's unusual. So if you find a lump, then the best port of call is usually your GP. You can get an appointment with them and they can refer you up either to the NHS under the 2-week wait programme, in which case you should be seen within those 2 weeks, or else if you have insurance you can sometimes go directly to a private surgeon. So if you are diagnosed with breast cancer, then there are various options that we can do. Surgery is an important part of the treatment, but what I specialise in is giving chemotherapy, hormone therapy and other targeted agents. Sometimes those are given ahead of surgery to try and shrink a cancer down before removing it. And sometimes we give these treatments afterwards in a bid to reduce down the chances of the cancer coming back. And often we use a combination of all of these treatments, so chemotherapy, targeted agents and hormone therapy, to reduce down the risk of someone's cancer coming back as much as possible. Most chemotherapy is given via a drip, given in through the arm into the veins. It usually involves coming into a chemotherapy unit, as we have here at Blackheath, for a couple of hours. You have some anti-sickness drugs which go in first, and then the chemotherapy gradually drips in over the next couple of hours. Then you go home on the same day, so you don't need to hang around in hospital for it. Unfortunately, chemotherapy does usually come with some side effects, things such as hair loss, for which we can try to mitigate against by using a cold cap, a hat that you wear whilst you have the chemotherapy that becomes very cold. And it can make you feel tired, nauseous, but we can provide medications which can try to minimise these side effects as much as possible.